Good afternoon, everybody, and welcome to the weekly Facebook Live here in St. Clair County. I'm Justin Westmiller, the Director for Homeland Security and Emergency Management. And as always, with us today is Dr. Annette Mercatante, the St. Clair County Medical Health Officer. And we'll get right to the statistics for the week. Totals to date, 8,186 total cases, 467 total hospitalized, 217 deaths, and 5,834 recovered. Changes in the last 7 days, 175 new cases, 25 average new cases per day, 312 average tests per day, and we're seeing 7.2% positive on testing, which is good. We're down below 10%. All right, this is the graph. We continue to go down. We had a little bit of a leveling off, and then we started going back down again. And this is the percent positive testing. You can see we're below 10% right there. This is a new slide. This shows the breakdown per week of vaccinations, and it's not cumulative. It's per week how many vaccinations were given. You can see the result from us having less vaccines provided to us there on the week after we had that huge spike, and then it dropped off a little. And then, as always, you can always follow along on all of our vital numbers at stclaircounty.org/offices/health/COVID19.aspx. All right, Jen, I think we'll get right to the questions.
Okay. Why don't we talk about first how this process is changing on our website on Fridays and the unexpected vaccine clinic that came up.
Okay,
Yeah,
well, I'll start. Let me start, and then Justin, you can talk about the system that we've settled on. So first of all, we have heard loud and clear that the registration system that we had for clinics, the open clinic on our website, was too frustrating. It probably would have worked a lot better if we had lots of vaccine and lots of clinics, but as our vaccine allocation stayed low and he actually went down, it was very frustrating to try and get an appointment. We know that. So we are, and Justin will talk about this, we are in the process of setting up a brand new registration process, and it should be robust and be able to grow with a growing vaccine allocations and accommodate the thousands and thousands of people who are looking to find a vaccine. So that's the good news. And so let's go back to last week when we were expecting several thousand doses of vaccine. We got instead 600 for first doses. We had to radically curtail our clinics, which we scheduled this week to focus on many of the key areas, the essential workers. In the course of the week, actually the conversations began late Monday into Tuesday. We started having conversations with Mcclaren Hospital, who did have some excess vaccine allocation. This is a result of the complex nature of the distribution. They were distributed vaccine through their large hospital system, the Mcclaren Health System, and some of it landed here in Port Huron, and they do have a distribution process in place. As you guys know, you can register at the Mcclaren website and get vaccinated, but it was a process that was going to be taking a while to go through their stockpile. So through a discussion, we very rapidly acquired some understanding. They transferred and reallocated that vaccine to us, and we set up the over 65 clinic for tomorrow, which was filled up today very quickly, but not as quickly as the one where we had 200 people in it. So this is a larger clinic. We were able to, we'll be able to provide 900 doses, and it still remains frustrating, I know, but let's face it, we're getting 900 extra doses in people's arms this week that wasn't otherwise going to be possible. And we want to once again thank Mcclaren Hospital and thank my team for just basically turning this around in less than 24 hours and getting it out there. So after this week, there will be no more waiting on our website on Friday afternoons. Don't go to our website. There's nothing new that's going to be posted. And as soon as the registration process is up, which Justin will talk about when he thinks that might be, people can go on anytime, day or night, register, and then they will receive a notice when that vaccine appointment becomes available to them. So we can elaborate on that process a little bit more. Justin, you want to discuss the Everbridge?
Yeah, absolutely. So in the county, most everybody's heard of WINS, and that's our emergency alerting system. The company that operates our WINS system is called Everbridge, and Everbridge created a product as this pandemic has been going on. It's a module that allows us to do scheduling and waitlisting and other features for vaccinations. It has other properties too, but vaccinations is what we're talking about. So we purchased it yesterday late in the afternoon. It does take a couple of days to make ready for the County of St. Clair. We are in that process now. We have a meeting with them tomorrow morning to start that creation, and we expect that that will take up to 7 days-ish or less. So we are pushing them very hard to do that, and that's we hope to have that up before the vaccines get to us, not next Monday, but the Monday after. So that is our expectation, and the company knows it, and that's what we'll be looking forward to. But some really great things about this is if you don't get in that vaccine, you don't have to continually go back to the website. You only have to go once. It holds all your information. It puts you on the wait list, comparing you to when your timestamp is, what priority group you're in, and it holds your place there to put you on the very next grouping to get vaccines. So there's no more waiting and seeing if you're in. You will just be managed automatically from here on out.
And we'll explain all of that once it's live. We'll do a press release. We'll do a video so people understand the whole process and how it works. There'll be a phone line as well. Can you explain to the viewers why we didn't have something like this set up from the beginning? Because we've been hearing about that too.
Yeah, so quite honestly, this company didn't start rolling this out until almost a week ago. And the minute that they sent this to us, we started talking about it. And within 3 days, we made the purchase. So we were already in the process of doing something homegrown, but this completely was 10 times more than that. And by the time we would have built it out homegrown, it would have been a month later. And this exceeds that completely. So we were already tackling this process, but this beats the process tenfold.
And I can speak to that internally. When we started the process, I could tell you that we initially anticipated vaccine coming out very quickly and being able to open up that acuity scheduler for more and more appointments. Certainly maybe underestimating the sheer number of people who wanted vaccines immediately, but also really underestimating how much vaccine we were going to get. I kind of felt the first week was going to be a little tight, but we expected it to just open right up, in which case I don't think we would have had as much trouble. The other side of this is we were planning very quickly, okay, we need a waiting list. And as I talked to colleagues around the state, we found that everyone who developed a waiting list had even more complications as a result of the waiting list. So it's like one solution created 10 new problems. And we were really trying to figure out how to avoid all those 10 new problems when we stumbled upon this, I'm frozen. When we recognized that there was something ready made. So it's not quite as easy as you might think to develop a waiting list for tens of thousands of people for a limited product that's going to come in slowly, especially with a limited work staff that's all busy vaccinating. So maybe we got out of the box a little slow, but I want you to know that we've been working on it for a while. And we hope that this solution coming up is going to be a good one, and it'll satisfy everybody's needs.
Yeah, Jen, I'm going to answer a bunch of the questions on the right, if you don't mind, because they're all tied to Everbridge. So
Okay, go ahead. Do you want me to
Deborah
read them to you, or?
No, I got them. I'm looking at them. Deborah asks,
okay.
who will be managing this registration? The county will be. The health department will be with support from emergency management. The no vaccination clinics next week, I don't think that's what we meant by that. So can I sign up? I'm 52 years old. No, not yet. I have 2 high-risk elderly patients. We'll talk about the no clinics next week. We didn't mean that. We'll talk about that in a minute. How exactly will registrations be prioritized? Like I said, it's going to be in the groups that are already available. So right now, teachers are being handled externally in a totally different process. They don't count in this. It's basically the 1A, 1A like medical personnel, and then 65 and older. And then it goes by time. So it's 1A and then 65 and older time stamped. That's how it's going to be managed for this portion. But this system will manage all of our scheduling from here on out till we're done.
So yeah, let's go back to that.
Go
So no, we cannot prioritize using a system like this based on your personal health risks. Not only that, but
Right.
I would want to touch whether your personal health risks are more severe than another personal health risk. And we have some 80-year-olds that are way healthier than some 66-year-olds. Okay, so it's still going to be 65 and older, and really it is still a first come first serve. It will take the names off of the list based on when they registered. So it's time stamped. So when it goes up, you got to go in, register. I imagine, and every system we know of that's gone live like this has had thousands, tens of thousands in the first 24 hours, but then it evens off. So that's the process. And don't forget that we're hoping to expand our clinics and make them bigger and bigger as well. So we should be able to work through people pretty well. The nice thing is you don't have to call back. Now let me just go back to the question about next week, because next week is a little tricky. If we're lucky, and I'm hoping we're going to get this system up to be able to use it for our open clinics next week. If we can't, we will still vaccinate. We will still take the vaccines we have available to you all and use them. We'll just have to go back to this crummy system that we have, okay? So I'd love to say this was it. Hopefully this is it. But if we end up with 1,000 vaccines that we want to use tomorrow or next week, and we don't, in fact, have the system ready to go, we will just go ahead and put our link back up and put the information out and do it the same old way. You're just going to have to bear with us, but hopefully we can latch onto the system next week, because most of our open community clinics are going to be Thursdays, I'd assume at the end of next week. We have a lot of second dose clinics next week. People are on their second round. We have a lot of second dose clinics next week, as well as some closed clinics. So stay tuned. We'll let you know as soon as we know.
And for people wondering, this will be a great system to use, especially once the phases open up to different groups. Mm-hmm. We'll be able to prioritize that a lot better.
Mm-hmm.
Yeah.
Right.
Go ahead, Jen.
Okay. Did you have anything else to add, or you want me to move on?
Yeah, I do. Just one thing. I hear this all the time. Are we able to use the National Guard? I could get the National Guard here in 45 minutes, no joke. It's very easy to do. Both Doc and I can make the request and literally have them here in 2 hours. The issue is we don't have enough vaccine to need them yet. The health department staff can manage the number of vaccines and the vaccination clinics that we have ongoing right now. Now, I have been working, and Doc knows this, I've been working throughout the last couple of days to talk about what are called mass vaccination clinics when we have enough vaccine available, and we have the ability to use Title X military members, military reservists to do that along with the National Guard, and we're set up and ready to do that as well. So when we get enough vaccine and we know that there's a steady flow of it, we are set and ready to roll on that as well. There are plans in place, and the support is there from both FEMA, the Michigan National Guard, the Army Reserve, or I'm not the Army Reserve, but the military reserves, and state EMHSD to make this happen.
Okay, I'm going to read off some questions that came in last night, because we always give people an opportunity to ask some. Okay. What kind of vaccine do you give, and how many days till you get a second shot?
So right now we're using the only 2 approved vaccines available, which is Pfizer and Moderna. They're both mRNA type vaccines. The Pfizer product has an interval of 21 days between the first and second dose, and the Moderna has a 28-day interval between the first and second dose. And that is the minimum interval.
Okay, Justin, are people under the age of 65 going to be charged for a vaccine, and who's paying for the cost for those being vaccinated now?
Sure. So any vaccine purchased with U.S. taxpayer dollars, you will not be charged for that vaccine. You could be charged for certain administration fees and things like that, but you will not be charged for the vaccine itself. And that charge should go to your insurance.
Okay. Either or, will you be taking the vaccine to people in senior apartments and to seniors who are homebound?
So that is a concern. Right now, it is not recommended to take vaccine from location to location. Given the storage and handling needs of this type of vaccine, there is a lot of caution about moving it from place to place. So when those guidelines and recommendations open up and we have a better idea how to take vaccine from place to place, that will certainly be one of our goals. And this may actually be more possible with other types of vaccines. But yeah, we'd like to be able to take a vaccine to where it's needed as opposed to having everybody come to us. But that also means that we're not doing a lot of vaccine. And right now the goal is to try and get as much vaccine out as quickly as possible. So there's a balance between trying to get it to the most vulnerable and the most needy and getting as much vaccine out as quickly as possible. And that balance and that problem is just going to be with us through the whole process. We're just going to have to keep working with it.
Okay. Justin, what is the group of people to get vaccines 16 to 64? Should it be broken down a bit better? So I'm thinking this person is looking at the phases, the priority phases, and they're wondering about how that process works.
Yeah, so we are following the prioritization from the state health department, and until they give us different guidance, we're going to go right down that line, to ensure equity throughout the state. So that's kind of the plan.
The priority groups were not just made up even at the state level. There's the Advisory Committee of Immunization Practices, the ACIP, which is a think tank of just a myriad of experts, not just people who work for pharmaceutical companies or for the FDA. There's a large deliberative body that's very independent from the organizations that make and distribute vaccine. They have been thinking and talking and researching this for months and months and months, knowing that this vaccine was not going to be a resource that was widely available at the beginning, that it was going to be a limited resource for people, and that we had to apply priorities to this. So these priority buckets have been developed with the smartest, best information available, and I am not going to rethink them and say that they were wrong, even that there may be glitches and gray areas that are a little hard. I have to just trust the expertise of the people who've put a great deal of thought into this. And so I know that it may not make a lot of sense, but I have to say I trust the judgment of this, and we're going to have to do the best we can to follow these guidelines.
Okay. This person asked, my husband gets Xolair shots, sorry if I pronounced that wrong, for his lungs every other week. Should he get the COVID shot the week in between, or does it matter? The medication, Xolair.
We do not have specific recommendations for timing of these particular 2 vaccines related to medications, nor related to medical conditions. And we've talked about this before. There is nothing specific. So I would advise an individual to have that discussion with their doctor. And my thought is probably the doctor's going to advise, as long as there's no acute illness, to receive the vaccine when it's available.
Okay.
You should discuss that with your doctor first.
Next question. This is on the live feed. How skeptical are you that this new strain will possibly spike cases in March? And if so, do you believe the current vaccines will be as effective?
How skeptical or how concerned? So I'm not skeptical that this new variant is a concern. It is a concern. It may or may not become the dominant strain. I think we have to wait and see of whether it's going to become the dominant strain. There's certainly a concern. If it's frozen again. If it's highly contagious, it has a much better chance of becoming a dominant strain. And then the new, and then that dominant strain, its capabilities will be the new thing we have to concern ourselves with. The good news is with the UK strain is that they've already done some in vitro studies with the virus and the antibodies and all these titrations to feel that the vaccines that are currently available will still work. So that's the good news. We're going to have to just stay on top of this and watch it. I'll put it this way. I'm cautiously optimistic that we will be able to respond to whatever we need to as this virus transitions. And remember, the dominant strain right now is not the same strain that we had in Wuhan. It's completely changed in the year that we've had this virus. So this is just something we're going to have to learn to live with this virus until we have a good handle on it.
Okay. Let's see. There's still some questions about the vaccine and the Mcclaren clinic. So we'll just, in case somebody missed that earlier, why didn't we use Mcclaren's list for the vaccines that became available today, since the county does not have the capacity yet to do a wait list?
I'll take that one.
I asked them that. Okay.
Well, they're still doing their clinic.
Why? Yeah, they're doing their clinic. They don't want to. They don't want to give that process up because that's a process that's working for a lot of people. And technically, there is no way of transitioning those names over. So we're just going to have to start with our own list and work. And it's okay if you're on both lists and you get in one place before the other. Just make sure you take your name off the other list. And they'll actually ask you that. If you get a request to go to a vaccine clinic and you've already received your vaccine, you're just going to decline and they're going to move on.
Yeah, I was going to say the same thing. I was going to say you're a patient at Mcclaren, and so they want to continue servicing their patients. So just keep on keeping on.
Thank you for clarifying that. Justin, I don't know if you covered this part of the new process, but if someone is assisting a 65 plus senior with our new system coming and they don't have an email address, how do we address this for their confirmation?
Yeah, so there's going to be a hotline attached to it. And like we said, we're going to create a whole tutorial video on how to do it, both for computer users and phone only users. We're going to make it very informational and easy to use so that anybody who's a customer of ours can make it happen on the first try. But basically what's going to happen is you'll call in to the hotline, and if you get a live operator, it'll just be a back and forth. If you need to leave a message and you have the ability to leave the information, then you can go ahead and leave the information. If you can't leave the information, then just leave a telephone number and an operator will call you back. But we'll work through all of that either here live next week once we're live and ready to go, or you can watch our quick tutorial, and we'll put it on all of our socials, and we'll put it everywhere.
Okay.
I was on a state call today, and they also said that the 211 system is going to work. They acted like it was already on. So 211 is an option for people. You can call 211 and tell them where you live and where you'd like to get a vaccine, and they will connect to our system on your behalf and work with you. And also the state has a COVID hotline that you can also call at 888-535-6136. And apparently that phone number will also get you an operator, probably knowing the state 9 to 5, Monday through Thursday, but it will get you an operator that you can, that can also assist you. So lots of options for phone numbers to call, and we'll make sure that you have those available to you as well.
Great, thank you. Okay, next question. Someone asked, what's the recommendation and possibility to get the same brand of the 2 shots needed? So if you start with Moderna and that brand isn't available, do you get Pfizer or vice versa?
No, we're going to keep with the same vaccine, and we should not have any problem doing that. But please be your own advocate for that. So if you got Moderna and you show up at a clinic that's only giving Pfizer, reschedule. We should not have any difficulty providing you the second dose of what you already received. The state's confident with that. We're pretty confident with that. So that shouldn't be a problem. Just know what you got and make sure you're in the right place.
And
Okay.
always bring your card, and that's how the vaccinators check it.
Now, if you have the wrong vaccine as a second dose, currently the recommendation is not to repeat it. But the problem is we have no idea how well it's going to work for you. So you've kind of, lost your edge there a little bit with the value of the vaccine. And we have no blood tests or anything at this point to really do a post-test to see, so it's not like with some vaccines we know what to look for and we can do a blood test after a certain period of time. We don't have that yet with this vaccine. So you got to do it right and hope for that 98% coverage that is in there.
Okay, the next question. I have a mother who is being paid through the state to take care of a handicapped person. Does that make her an essential worker and eligible to register now? Also, she was asking about helping out as she is a retired nurse. How would she get in contact with us? So that's a 2-part question.
Go ahead. Do the volunteer part.
Yeah, so for volunteer, I saw her thing. She's already a member on my volunteer registry. So I saw her name too. I'll write that down and I'll talk with our volunteer coordinator and see where she's at on the list and what's going on there. And Doc, I'll let you answer the other part.
Do you want me to repeat it, Doc?
No, she wants to know whether somebody is considered a 1A person if they're a paid caretaker of an individual. And I would have to say yes, but it does get a little sticky because then you ask, well, I'm the caretaker of my grandmother in my household. Shouldn't I be a 1A as well? And that question actually has come up this week, and we are waiting for some guidance on that. It is not clear. So if you're 42 and are the caretaker of a loved one, it's not clear that you're eligible at this time. We're going to need some clarity. It makes some sense, but I think this whole issue of, again, limited resources and how widely do you open that door up for other groups. So,
she is on our volunteer list. I just looked.
Speaking of that, another person had said that they had already completed the Michigan Volunteer Registry and they're still waiting to hear.
Sure. Well, we haven't needed to use everybody yet. We've only been providing a few hundred vaccines at a time at a clinic. We can do that with hardly any volunteers. So stay tuned, because when our vaccine allocations go up, we're going to need bigger clinics and we're going to need more people. So we will be pulling from that registry as needed. So.
And they'll definitely be contacted if we need them.
Mm-hmm.
Okay, the next question is, how is information on expected vaccinations coming to the county?
So the question, Doc, is how do we find out how many doses we get every week?
So we find out on Friday. We put our order in Wednesday, and we're only ordering for second doses now. So we can say, okay, we've got 2,000 people who are due for their second dose next week. 800 are Moderna and 1,200 are Pfizer. We are expecting to get that much. At least that's what we've been told. We are no longer able to order any of our first doses. The first doses are going to be distributed by the state based on a formula that they've come up with that I haven't quite seen yet. I don't know what it means for us, but hopefully this week will be the first week we get our allocation based on that formula. That should give us some idea. And it's based on population of over 65, how many essential workers we have, and it also uses a social vulnerability index how many people we have that don't have transportation, things of that nature. So based on that, we will receive an allocation. And that is also going to be impacted by how much the state gets from the federal government. So as the state gets more, I'm expecting we'll get more. But it'll be proportional to this formula. That is about as much as I can tell you.
Right.
And
we wish we had the answers to everything.
And we find out on Friday.
Yeah.
So as soon as we find out what we expand our clinics the following week, which is how that Friday scheduling thing came up, which we won't have to worry about. Hopefully, moving in the future, we'll just send out the links once we know. But this coming week, we'll again, we're not going to put up any appointment links on Friday, so you don't have to rush to our website on Friday. But if we do have to schedule clinics without the Everbridge process, we'll put out a press release and do what we did today with expanding a clinic. So,
yeah, the promise I'll make to the community is that we will. I hope to only have it happen one more time, if it happens at all. Okay.
If it happens at all.
If it happens more than that. Justin. Yeah, if it happens more than that, you can set up a firing squad somewhere.
You are on the hot seat now, man.
For sure, I know that. But the other thing I wanted to say was we both Doc and I have gone up our different lanes to the state, to highest parts of the state, short of the governor. And, we have said we really need to understand what this formula is so that we can talk to our community and explain to them, because the more transparent we are to our folks, the better off everybody is. And they have stated to us that they're going to do everything they can to get it to us as soon as it's releasable. So we are working on that.
Okay, next question. Tomorrow, my dad has his first dose scheduled. Will they schedule a second dose appointment at that time?
Yeah.
Yeah.
Okay.
Yeah, you leave your first dose appointment knowing when your second dose appointment is.
The next question. Yeah. I've heard the vaccine only works for a certain number of months or time. How long do they last if this is the case?
So the research isn't out yet. We don't know how long exactly it lasts, but I can tell you it lasts longer than a few months. Because the clinical trials now are going into, some of them into the 7th, 8th, 9th month. And we are hoping that the vaccine will last. I think most of us hope it'll last at least a year. So more to come, but I'm sure you're going to get more than a few months coverage. That's just to say 6 months is a given, okay? So hang in there for more information.
This person asked, the guidelines for moving vaccination to senior living, ? Is that a state-by-state decision?
No, I don't think so, because from what we've heard, the concerns about moving vaccine from place to place is kind of a manufacturing vaccine viability issue, right? Because you run the risk of it not losing its effectiveness if it goes outside of its temperature range. Yeah. So this has more to do with the storage and handling of a vaccine, which is it's very delicate stuff. I mean, this is high science. So if you do know of places that are doing it outside the state, maybe they've come up with some protocols, but our state is still trying to wrangle with that, and they're still advising against. They understand doing it within homes and stuff is important, but they're still at this point advising against moving that vaccine from location to location for now.
Now, there is some good news on the horizon. The next couple of vaccines that are going through testing and will come out soon, they are not mRNA vaccines, and their temperature requirements are not the same, and their travel requirements are not the same. And when that happens, we do have a better option of going out and doing these road shows. So we are looking forward to that as well. That will be an option then, or maybe an option.
So someone asked what vaccine is being used tomorrow at the senior clinic.
Moderna,
yeah.
Okay. People had missed the beginning of the live show, but I think you covered that since she answered. They want to know if we're still going to have the scheduling on Friday, but you said obviously
You know what?
that's
I'll wrap that
changed.
up at the end. Elise just gave me a
Okay.
note to make sure I remind everybody again about this new registration process. So why don't we just wait till the end, and that can be
Okay.
my closing comments, so everyone catches it.
Perfect. Okay, the next question is for you, Dr. Mercatante. This person wants to know, is it safe for an 84-year-old to receive the vaccine if he was recently diagnosed with ITP in November? And then goes on to talk about different things. Platelets
Right.
have returned to 170. Can you see this question,
Yeah.
Doc?
I
Okay.
can. And I go back to the fact that this vaccine has no specific recommendations for any physical medical problem or medication. Okay. So the advice is that you can provide this vaccine. It doesn't indicate based on condition or medical condition, but to consult with your physician first. The issue is maybe the prednisone, the immune suppression drugs that they're on, and whether or not that may impact the effectiveness of the vaccine. And it may. It's pretty low dose. It may not. So you have to, if you're going to take the vaccine, you have to take that into consideration, that the effectiveness of the vaccine may not be as reliable in a situation like that. The safety issues do not seem to be the concern here. It's just whether or not the vaccine is effective in those situations.
Okay. Well, all the rest of the questions pretty much are about the new process, but I just wanted to see, before we ended the show and you recovered, went over those things again, can you just talk about, for people who did not get an appointment for tomorrow's clinic, not to show up without an appointment, those kind of reminders? Maybe
we have to consider this kind of organized chaos. These are not normal times. This is not a normal distribution of vaccine. These are not normal times. And we have to request, even beg everyone to be patient and to be compliant with the process. It's not perfect. We'll keep working on it, getting better. But if we had people just randomly show up at our clinics, it would take a difficult situation and make it impossible. So please don't. There will be more vaccine coming. It makes it very difficult on our staff when there's lots of people who show up for vaccine and they don't have any, they're not registered. We can't get into this kind of disorganized free-for-all. It'll make it harder on everyone. So let's stay the course. Be patient with us as we improve the system. Get your appointment and show up at your appointment. If we decide that we have the ability to expand, I'm frozen again. So if we have the ability to expand, I'm frozen again.
You're good.
No, I can hear you.
You're good. Okay. I keep watching my face freeze. I think we've proven, at least our intention, from what we've done this week with this unexpected amount of vaccine, we turned it around. We put it out there as fast as we could. If we have an expansion of vaccine that's unexpected, we will turn it around and put it back out there for you guys. So that's our promise, and we're going to do it as fairly as we can, but we have to follow a process, and please follow it with us. I'm just asking for your cooperation.
There actually is another question that came through before we do closing comments. Should you stop antihistamines prior to vaccine, and how long before should you stop?
There is no guidance on that.
Okay. And the last question that came through is, a volunteer under 65 at a free meal site considered an essential employee?
No.
No, sorry.
Okay.
And I want to answer one real quick. Laura Troy, unfortunately, my coordinator went off at 4 o'clock. So if you didn't see, I took a picture of your name, and I will check the list as soon as she gets in first thing tomorrow, and we'll figure that out. Okay. If you want to email me or call me at my office, I will get back to you.
Okay, let's do closing comments and recap a few things. Ready?
So let's go. Yeah, so let's go over the new and improved process that is being spearheaded by Justin and his team, as well as I want to shout out a thank you to the county administration and even our board of commissioners who've really rallied to kind of move this forward much quicker than we would have been able to do on our own. So thank you for that. We think that the system is going to be very robust and very much better for all of you guys, and we'll be able to do a lot better job getting people scheduled. So that's coming. We're hoping it's coming in time for next week's clinic. If it isn't, we may have to go one more round with our clunky acuity system, and we apologize, but I would rather use a system that works poorly than not vaccinate people at all. Okay, because our other choice would be saying, we'll take a pause while we fix everything. And I just don't want to do that. I think if there's vaccine in our hands, we want to get it out to y'all. So please be patient with us for that. And I think we're all going to be very pleased with this new system once it gets up and running. So thank you for that. And thank you for letting us know that we needed this. We knew we needed this, but I think your urgency really helped the urgency of all the people that needed to get around the table and say, yes, let's get this done. So it does take a village, right, to do this. So thanks everyone, and we'll see you next week, and we'll keep up this conversation. I guess the other thing I wanted to say, back to me, sorry. I did want to say something hopeful, and that is our rates and our transmission rates are improving, and this is a great time to be able to take a deep breath and say, okay, we're finally getting some rhythm with this vaccine. It's going to start coming out. This is giving us the opportunity to get people vaccinated in this lull. And so I want people who are on the fence thinking about the vaccine to start really thinking about it, because as this opportunity expands, this is going to be the best time. We talked about the worries about the variants. The way we're going to fight against variants that are more contagious, whatever, is to use this vaccine. So I think this is a perfect break, and the good Lord is shining upon us. So that's what I have to say. Now,
okay, Justin.
Well, first off, I would really appreciate if you would actually shine upon us a little bit, because I'm getting 23 degrees and below. It's getting a little old. But first off, to our community, I want to tell you that your voices have been heard very loudly. Both the health department staff and the emergency management staff are going to work as hard as we can to make this scheduler right, and to get it to you all as soon as absolutely possible. We want it to be right, like I said, and we want it to be functional. So one of the questions I saw that we didn't quite get to is, you can potentially with this setup pre-register, but you just will end up in the queue for a very long time, and you will be notified. But we'll talk about all that next week. Listen, as Doc said, it looks like we are potentially turning the corner for now. But like she always says, and I always hear, we can't let our guard down, but we can enjoy what we're seeing right now. So we kind of have to find the happy balance between the two. I really appreciate each and every one of you, even the people that ask the hard questions. It keeps us on our toes, and I look forward to Facebook Live every week, believe it or not. So thank you all. Have a wonderful week. And as always, if there's any issues or you need anything, feel free to email us at covid19@stclaircounty.org. And we'll see you next week.